Thank you for tuning into the Zelos podcast. I'm your host, Rocky Snyder. This week, I've got Michael Messer on with me from the Nashville Football Club. He is the head physical therapist. We're going to talk about non-contact injuries, return to play, his path on to Nashville, and a whole bunch more. So follow along with us on Instagram at Rocky_Snyder. Click the subscribe button and enjoy the show. Well, I've got Michael Messer in the house with me. He is the team physical therapist for the Nashville Soccer Club. And before that, I believe he was in Virginia, but we're going to find out right from Michael to understand his career path and what life is like in Nashville. So, Mike, welcome to Zelos. Thanks for being on.
Thanks for having me, Rocky.
And so give us a little bit of a breakdown as like, where did you grow up? Where did you go to school? And how did you land in Nashville?
I spent the majority of my life in Richmond, Virginia. I was born and raised there. I went to school not too far away at the University of Virginia for undergrad. And then after that, I went even closer to home, Virginia Commonwealth University for PT school. First year out of school, I worked in an outpatient ortho clinic. And then from there, I was actually able to get a job at Virginia Commonwealth University working with their sports medicine department. So I spent 3 years there, really tried to develop my relationship with the athletes, the coaches, the athletic trainers, just everyone on staff, physicians, other PTs. And that was where I really started to develop my love for sports PT.
And so I'm curious, you had so many different directions with physical therapy, from gerontology and neuro, stroke rehab, children. What was it that inspired you to go with sports med or physical therapy for athletes?
So I've always been soccer player, much to my dad's chagrin. He really wanted me to do baseball, but what wasn't in the cards. In high school, I remember having, I believe it was a hamstring injury, and going through the rehab for that. And I think that was the first time I ever thought, hey, doing this rehab thing, that might be something I'm interested in. It took me, I think, until my second year of undergrad to declare a major. And then once I decided that PT was the way I wanted to go, I knew that sports was what I wanted to be involved in.
Just out of curiosity, what were the other courses that you were kind of exploring in those first 2 years?
I took a little bit of everything, to be honest. I think if you looked at my transcript, you'd have a hard time figuring out what I was doing those first 2 years.
We got that in common, that's for sure.
I was really fortunate that the program at Virginia at the time was a little bit smaller. It was a 2-year program, and I think the class size has, I think, at least tripled, and is now a 4-year program at Virginia. So it became pretty popular after I left.
Wow. And then your master's, where did you go for that? Was that where you went?
So Virginia Commonwealth University was where I did my PT degree.
I see. All right. And so you were and then you got a job there as well?
I did, yeah. So I did spend 1 year in an outpatient clinic. And then again, I was very fortunate at that point in my career to get a position in a sports medicine clinic.
And what was that like?
It was great. I really enjoyed it.
What parts did you enjoy? Just kind of what aspects?
So that was probably my first exposure to like the multidisciplinary team setting. So we had the physicians right next door. We had other PTs. We had literally a glass wall separating us from the athletic training staff. The strength and conditioning staff were right there. And so, for me, it was just great to, second year of my career, get exposed to a little bit of everything and start to see how all the pieces fit together and really start to build some of my thought processes for, building into my sports PT career.
And okay, what were some of the big building blocks when you think of this construct that you were going through?
I think for me, in school, you get your ortho. Maybe if you were an athlete in the past, you start to see how you can kind of connect some of those dots. But for me, it was really starting to think about how to progress just say a standard ortho injury into a more sports specific environment, and maybe some of the little things that you change or tweak to do that. And then also just the realization that, even at the collegiate level, these are high level athletes that even though they're injured, there's so much more to it than that. And you've got to think about their nutrition, you've got to think about the rest of their body. And so, you don't want to get to the end of your rehab and then have fallen behind on their fitness, maybe some of their S&C programming. And then now it's almost like they're having to do not necessarily rehab, but catch up to get back to their normal level of performance from where they were before.
Were there any major like light bulb moments for you coming out of your learning at school, your master's, so on, and applying it into real world scenarios? Like there was an understanding that this is how I needed to treat this athlete, how I needed to approach it. I was going to use this protocol, and then you realize actually this is what they need instead, or your staff members are showing you something, your colleagues are going, oh no, this is how we do it, and you're going, oh my gosh, I had no idea. Anything like that occur to you?
Well, honestly, I think the great thing about this field is that I still have those.
Awesome. Excellent.
There are a ton of smart people in this world, a lot smarter than me. And I know that there's always more than one way to do things. And I am always willing to learn and grow. And I think early on in my career, maybe a couple of those instances were more around it's early on, especially with like post-op athletes or patients. It's nice to go by a protocol that's laid out in front of you, and the protocol exists for a reason. But particularly with athletes, you start to realize, hey, mate, they're doing a little bit better than maybe they should be at this point, and maybe instead of looking at this piece of paper, I need to be looking a little more closely at the person in front of me, and maybe we can move the needle along a little bit quicker here than maybe we normally would. So I think for me early on, that was kind of a light bulb moment.
Right on. Okay, so give me a little bit more down the road. You've just finished the job there, and then what happens?
So I was working with a lot of different athletes there. I did enjoy working with my soccer athletes the most. And I went to a continuing education course over in London. It's called the Isokinetic Conference. It's, as far as I know, the biggest soccer medicine conference in the world. Mm-hmm. And I went there, and it was kind of like, wow, like here are all these practitioners that work solely in this sport, and the sport that I love so much. And that was when I kind of got to thinking about, maybe there's a way for me to make this career for myself within, soccer medicine. And the following year, it was in Barcelona, and two things happened that I think really changed the course of my career. Both were kind of chance networking while I was there. I spoke with a friend a colleague who told me about a position that was open at Duke. And I also incidentally ran into the chief medical officer for US Soccer and just struck up a conversation with him.
Nice.
So from there, I think while I was still in Barcelona, I scheduled an interview at Duke, and that position was what they called a soccer outreach coordinator. So essentially clinic care, but they also kind of had a pre-existing program within the community, mostly at the youth level, to do a little bit of coverage, a little bit of rehab, a little bit of prevention. And then Duke was also, or is also, I should say, one of 3 FIFA Medical Centers of Excellence in the US. And so I kind of was at a crossroads of, do I stick with working with collegiate athletes, or do I take this other opportunity and work more within the sport I'm really interested in? and I went the sports route with Duke, and that position just allowed me to wear so many different hats, from research to on-field care to rehab to prevention. The program grew. I got to learn from probably my best soccer mentor, which was Dr. Bill Garrett. Unfortunately, I was only there about a year and a half, 2 years before he passed away. But what I learned from him in that time is just going to affect my career the rest of my life. And from that chance encounter with Dr. Chiampis, the chief medical officer for U.S. Soccer, it eventually turned into an invitation to come in and work at a men's national team camp. And so I was able to do that for, I think it was about 2.5 years. So just those two opportunities to, work at the highest level in the game, as well as kind of the youth, collegiate, and all the way up, really, really exposed me to a lot of different levels and opportunities within the soccer world.
Phenomenal. I love it. I love it. Okay, so with your mentor at Duke, who passed away after about 1.5 years working with him, you mentioned that there's some things that you're just going to take with you that shape your career. What are those?
So I think for me, I was able to observe him, even though he was a physician, I was a physical therapist, just observing the way that he interacted with his athletes, so the way he spoke with them, the way he presented information to them. He was really able to connect with them on their level, and his intimate knowledge of the game really came through, and how he was able to connect the dots from what he was telling them medically to what it meant for them on the field. I think it made the process, for him and for the patient so much easier than it could have been had that skill not existed.
Just almost, I get a feeling that it was instant buy-in as soon as he spoke their language.
Yes, absolutely. And that, as a practitioner, that really goes a long way. If you don't have to spend time really building and creating that buy-in, you get to move towards your goal a little bit quicker.
Oh, fabulous. Okay, well, where the heck did Nashville come in?
That's kind of another lucky series of events.
There's no luck involved here, man. You just open doors of opportunity. You don't leave them closed.
So, Nashville started as a team in 2020, and I had kind of felt like my career at Duke was building towards, maybe being in a team environment. I really enjoyed the time I got to be away with the national team. I had talked to a lot of different practitioners. They said there are pros and cons, and I just kind of reached a crossroads again, where it was like, do I go this route and just kind of test the waters and see if I like it or not, or do I just keep on the path I'm on? And their first year, so actually what I did was quick shout out to my wife. I created a list of all the MLS teams, and I said, where would you go if a job opened up at MLS and NWSL, actually? And I said, you circle the places where you'd be interested in going, and I'm gonna keep my eye on those. So first year, Nashville actually did post a physical therapist position, and I put my name in. And I happened to be at a dry needling course in Chapel Hill, North Carolina. And we all had to introduce ourselves, and there were two people in there who were athletic trainers that worked in the soccer world. One of them with Atlanta United, and the other said she had been with Nashville at the USL level. So just, being a soccer person, I introduced myself to them, chatted with them a little bit, and I was really disappointed because I never heard back about my application. And fast forward a year, the job gets posted again, and those two athletic trainers reached out to me, said, hey, we remember you. We've got this opening. We think you should apply. And it just so happened that that was right before I was going into a national team camp, and one of Nashville's players was in camp, Walker Zimmerman, and he put in a good word for me. I had I think the blessing of the two assistant athletic trainers. It led to an interview, and a few days later, I was offered the job.
That's awesome. I love it. I love how pieces of puzzles don't come into full view until they start getting connected. But wow. Okay. And so what it's been like for you being head physical therapist of a professional soccer team? What is that like?
I've loved it. I've loved every second of it. Whereas at, as I mentioned at Duke, I was wearing a lot of different hats. I really get to focus on being a clinician and immersing myself in that world, in this environment. And, one of the things that always just irked me a little bit about working in a clinic was I didn't always feel like I had enough time with the people in front of me to make as big of a difference as I wanted to. And for better or worse, I'm stuck with these guys in this environment.
Well, how much time are we talking? Because I know I've got a lot of colleagues that are physical therapists and they're in the private sector, and they're shrinking their time down, mainly because of insurance coverage and so on. But it was going from 40 down to 30, now to 20 or even 15 minutes. What are we talking when you're with an athlete? Just on average, how much time do you get to spend?
In my current role?
Yes.
So I would say there's really no cap on how long I necessarily get to spend with them. I would say
you're so spoiled. That's amazing.
I would say in general, the athlete is in 5 to 6 days a week, and they probably spend, specifically with me, anywhere from an hour and a half to 2 hours a day with me. It may be broken up a little bit with some other things in between, but in total, the guys in rehab are probably spending at least probably 4 hours at the facility, actually doing different activities.
Okay, but with you, you already mentioned dry needling, so I bet that's a portion of it. If it's something that's in their, I'll say their recipe for return to play. But what other modalities do you do? Graston technique, ART, MAT. What other kind of tools are in your toolbox? Just curious.
Yeah. So do you have dry needling? Instrument assisted soft tissue. We have a few different, I'd say maybe not standard training room modalities. There were a couple I was introduced to when I came to the club. One is mat, which is kind of a oscillatory, like a deep oscillatory electrical modality. Another one's called a Vaja, which again is like a microcurrent, but it gives you a feedback reading of the electrical current from the athlete, so you can kind of adjust your treatment as you go. We have shockwave. We have low-level laser therapy. So we have a few different ones that we'll implement. And then, over the years, I've taken a few different manual courses. So kind of not necessarily one methodology, kind of a sprinkling of various ones. So I would say from a, kind of an on-table standpoint, at least for me, that's what makes up most of what I do.
And speaking of the table, I could see in my mind you working with one of these pros and doing a little work on the table and then integrating in some movement. And then let's go back to the table and then let's go and integrate and assess, reassess. Okay, here's where I want to kind of work on now. Am I somewhere on the right path?
Pretty close. Yes. I would say for me, it's a little bit more, kind of the test, reassess, is retest is in the gym. I'll almost do the table stuff first, do the rehab session in the gym, then see if there's still anything kind of left over at the end of the day that we need to try to address on the table. So I would say mainly in the gym, I'm trying to kind of take different exercise approaches to create and drive more of that change.
Right on. All right. And now, how many other physical therapists are on staff with you?
Just me.
Oh, no wonder. All right. Okay. But then you've got athletic trainers.
We do. So we have a head athletic trainer, we have 2 assistant athletic trainers, and we have a massage therapist that make up our first team medical staff.
Gotcha. Do you have any interns that work under you?
We have, I would say not throughout the year. We've had an athletic training intern, and then I have had a couple students this year, but it's not necessarily a consistent thing that I have.
And what about traveling with the team? I can see the athletic trainers traveling with the team on away games, but is that required for you too, or do you, or whether it's required or not, do you travel with the team on all away games?
With Nashville, I do not typically. Typically, I will stay behind with the players that are injured, and we'll continue rehab. There have been a few trips that I've gone on, but the circumstances kind of have to be perfect.
Got it.
There's been a couple of longer term rehabs where guys were getting towards the end, and just to change the scenery, we would both go on the trip, do our rehab there rather than staying behind, just to, start to feel it a little bit more, motivate them to get kind of over that last hurdle and back in with the team.
And then when it comes to the team, are you also overseeing the academy players, or is it primarily first team for Nashville?
It is primarily first team. We, as an organization, I think are pretty unique within MLS in that our first team, our second team, and our academy are all housed at different geographic locations. So there are some obstacles to trying to oversee all levels of the organization.
Do you, as part of your role, do you need to go to the second team and academy locations just to kind of get familiar with the medical team that's there?
So I would say that's the goal.
Yeah.
This is our second team's first season. We moved away from the academy probably about 2 months ago into our new training facility. So there are a lot of things that are still in development that we're trying to figure out. But that being said, I would say I pretty frequently am, speaking with them on the phone or, email to not necessarily guide, but just any questions they have that come up that are rehab related, I'm able to kind of put in my 2 cents worth.
Now, I'm curious, kind of a side note, because you guys are would consider expansion team, right? But so too is the Carolina team. Adam Parr down there. Do you guys communicate within the expansion teams like, hey, this is all new. This is new stuff for us. We're building from the ground up. What are you guys doing over there? Here's what we're doing.
So I would say, in terms of communication in that context, I have not necessarily had those interactions with other expansion clubs. I talked to a lot of different other practitioners across the league, physical therapists, athletic trainers, performance coaches. But interestingly enough, we've not necessarily discussed the topic of expansion related issues.
No, bro, those guys are on their own anyway. Yeah. Just keep your trade secrets in Nashville. We'll say that. Okay, how about this? You mentioned that one of the elements that kind of swayed you in this direction was your own sports injury of a pulled hamstring. And what I've found over my career is that people that have injuries are usually some very knowledgeable individuals about that particular issue. So pulled hamstrings, what are you going to do? How do you assess a player, and not just for the symptom itself, but do you hunt down underlying causes? Like, how do you go from soup to nuts with a pulled hamstring with one of your players?
Yeah, so there's a lot there.
There is.
I I would say, if I had to summarize my approach, hamstring and so on and so forth. Obviously, I'm going to get a really good subjective history to start, because the subjective history is going to help guide my objective exam. Very early on in the injury, if there are symptoms that are going to be barriers to us progressing in rehab, whether it be pain, swelling, lack of flexibility, etc., those are going to be the things that we just have to attack and get rid of early on. From there, I want to find the things that are problematic for that athlete, whether it be they have a hard time getting into different positions, they have hard time doing specific movements. What is their tissue loading tolerance? In this setting, I'm fortunate in that I do get access to some of the fun toys, whether it be force plates or isometric dynamometers, the Nord board for hamstrings.
Mm-hmm.
That allows me to have a whole further wealth of knowledge and data that I can draw from over the course of rehab. So, once I have progressed past those first few symptoms and I can really start to get into the nitty gritty, that's where I'm going to figure out, do they feel it more with hip biased movements? Do they feel it more with knee biased movements? With the diagnosis, if we've done an MRI, where in the hamstring is this injury? Because I'm going to treat a tendon differently than I'm going to treat a myotendinous junction, then I'm going to treat a muscle belly, then I'm going to treat a retinaculum. So
Sure.
That, I think, is an important piece of the puzzle as well.
Huge.
And then again, depending on what that is, that's going to kind of guide our exercise and how we load a little bit. Obviously, the hamstring is really important for decelerating, really important for high speed running. In soccer, some guys feel it when they're shooting because it's eccentrically decelerating their leg on that follow through. So, I would say each phase of rehab, I try to be very specific about what can't you do? All right, we're going to attack that. We're going to reverse engineer that. We're going to find where your threshold is. I'm going to find how I can, as quickly as possible, build you back up to that. And then when we kind of get towards the end, we have our objective criteria that, again, just depending on what the injury is, we want them to meet in the gym before they get out on the field. And then, probably one of my favorite parts is the on-field rehab and how you can build that and shape that to make sure that not only is that athlete successful in the field, but they don't wind up back with you injured with the same thing.
I can only imagine that being the case, because energetically, emotionally, to be just back out on the pitch and gearing up and going sub-maximal on sprints or whatever, they're going, okay, I'm getting closer to return to play. So compared to early on in the process, and their emotions are depressed and down. Okay, so that was an awesome answer. You just unpacked a whole bunch of stuff. And true, like hamstring pulls could be proximal, distal, in the retinaculum, it could be in the belly of the muscle, like you say, tendinous, and so on. And hopefully you don't see so many, but of the ones that you do see and the experiences you have had through the college years and beyond, do you see trends? And what I mean by that, maybe I can paint a better picture, is that high hamstring pull up by the ischial tuberosity. What we find there sometimes is the inability for the pelvis to really tilt properly. Maybe they're already situated in an anterior tilt, putting that into a lengthened state, or no, what we notice is their lack of dorsiflexion at that talocrural joint, or actually there's too much movement, so they lose the ability to control, and so the hamstring kicks in? Anything like that? I mean, we could totally geek out right here, right now.
We absolutely could. And that was, as I was sitting here thinking about my answer, that was kind of the other piece of it. I think mentally right now, I would struggle to kind of speak out the tiers in my head, but I almost have like a kind of a tiering system of the issues that I need to address over the course of a rehab to make sure that, you know, that athlete gets to where they need to be, and all the things that you just touched on. Once you got to treat the injury, you got to get it healthy again. But all those other things are pieces of maybe why they got hurt in the first place, or, hey, now's a perfect time to address these things, because, maybe when they're injured, they're not going to necessarily want to put in that time to do so. So, I think for me, that kind of lumbopelvic stability and control is a big thing. I know from a biomechanical standpoint, sometimes it's kind of a deep dive to use some of that technology that gives you that information. We've been working a little bit with a company called Brave Virtual Worlds, and they have kind of the little sensor suite that the athletes wear, and we can get range of motion, joint velocity, joint acceleration, deceleration. And so, get some good information from that. This year's Isokinetic conference was in London, and one of the big things with hamstring injuries was biomechanics, and specifically while sprinting, what does that look like? And then how do we change that? So I'll be honest with you. I think for me, even 10 years into my career, this is an area that I know the basics of, but I think kind of that deep dive into how do you really do that in the gym and carry it over to when someone is running at their top speed. How do you make that stick? So yeah, I mean, again, your original question was what are these other trends you see? I think for me, biomechanical is a big one. A lot of the guys you got to think above and below, right? So sure. You mentioned the ankle. Think about the lower back, hip mobility. It all comes into play.
Okay, and then just changing the channel slightly here and going upstairs to the head. Concussions are part of the game, and the awareness of concussion protocol, shall we say, post-concussion syndrome awareness, and so on, brought about primarily with the NFL, but it trickles over into all of our other sports here, including Major League Soccer. What over the last few years has changed? Like, what in your role with the players, has anything changed in regards to concussions, or how are you guys dealing with that?
So, the MLS is pretty strict with its concussion protocols and reporting, which, I think with our current level, just globally, with our current level of understanding of concussions, for me, it's the most important organ on your body. So probably better to be safe than sorry. So, we have preseason baseline testing. We actually the league has, we have to designate a medical director for every home match. And then we also have a spotter. So someone from the league is watching the match. And if they see something that looks like a head injury, they actually call it in to the physician on the sideline, and that player has to be followed up with. They're able to, call in injury mechanisms from above. So it's definitely incredibly important to the league. I think things are actually, I will confess, I haven't looked at the paper yet, but I do know that the SCAT 6 just was published. And so, the league has told us that will be implemented at some point in the future. So we'll kind of move from the SCAT 5 to the SCAT 6. I don't know how much that will change, but concussion is absolutely a very important topic, and growing topic, not just within MLS, but all the sports leagues.
And then, so for those athletes with a history of subconcussive or concussion, post-concussion syndrome, I guess, I don't really like using the word syndrome, but others coin it. So how does that play into their current conditioning? Like, let's just say the insult or the occurred last season, but we know through research that symptoms can manifest many years down the road. So is there some kind of folding in to conditioning programs right now with existing players that may not exhibit anything right now? But are there anything I know you're not the strength conditioning guy, but like within your realm, is that being part of it, or have we not gotten to that point yet?
I've seen bits and pieces, I would say. I think that if you look at and I will confess, this is not an area of expertise for me, but from what I know of the existing literature for concussion prevention, the headgear, the exercises, not necessarily conclusive that does anything to prevent a concussion.
Sure.
So, I have seen some exercises implemented within a just kind of maintenance strength and conditioning program specifically for players that have a history of concussion, to try to improve the neck stability, neck strength. From a conditioning standpoint, I would say I've seen it more so with guys who have continued to experience symptoms here and there. So not necessarily a specific way of conditioning someone who's been asymptomatic for a long period after a concussion, but someone who here and there will have some symptoms return. We have had to, in a few instances, I don't want to say necessarily get creative, but have to manage those athletes a little bit, kind of find their triggers and then dose them appropriately to try to get them back to full health.
Yeah, that's a kind of a unique recipe for success there. And there's not one favorite program that's going to work for every person. What about the other issues that you come up with during the season? Like inversion sprains, we'll probably get some back issues, but what are the common things that you have to address as we're into two and a half months into the season right now, somewhere around there? I know you guys are coming out to San Jose in September. That's all. And if you want to travel out here, we'll meet at PayPal Park, but because you'll be going against my Quakes. But like right now, mid-season, what are your big issues that you're dealing with?
I would say in my experience here, soft tissue injuries have been the big ones. And that's hamstring, adductor, a few quads, a few calves. So really lower extremity. I would say from a more of like a chronic standpoint, foot issues, whether it be toe, not necessarily plantar fascia. So yeah, probably more so toe and some variety of chronic issue there. Nothing really with the upper body, like you said, back pain every now and then, but nothing major. A couple of AC sprains at the shoulder, a couple concussions, but definitely lower extremity heavy and mostly biased towards soft tissue.
And what about the ACL incident rate? It's not nearly as extreme as the NFL, but is that a common occurrence? Like to some grade? I mean, not full tear, but maybe grade 1, grade 2, that kind of thing?
I'm gonna knock on all the wood that I can find right now. And I'm gonna say no. Fortunately in my time, I'm trying to think through all levels of the organization. I want to say that the only ACLs have been at the academy level. And even then it hasn't been a lot, maybe 2 or 3. So again, very fortunately with the first team, we have not had any yet. They're always going to happen at some point, they will, but definitely not at the rate that they occur in some of the other sports, which again, knock on wood, we are very fortunate.
And do you think, and it's just sheer conjecture at this point, but do you think because the majority of your athletes actually continue in the off season to play, maybe not for other teams, but they're still kicking the ball around compared to, say, NFL players who, when the season's over, they take time off from that forceful kind of impact and trauma on the gridiron? Do you think the resiliency factor comes into play here if we're comparing the NFL to the MLS? Obviously, you're going to have a lot greater impact of bodies smashing into each other because we're not talking World Cup soccer, we're talking MLS and not but the NFL. You know what I'm saying? Like, is there an element of resiliency in the tissue because your players are, for the most part, playing year round?
Ooh, that's a whole big can of worms, isn't it?
I love opening cans of worms. I don't know. It could be.
I feel like there's a lot of different.
Just come out with the easy answer and say, yeah, maybe. Perhaps it depends. It depends. That would be good.
I could make an argument that it's a good thing. I could make an argument that maybe it's a bad thing. Our guys wind up having about a 6-week off season, so they're going at it most of the year, which, like you said, maybe that keeps them in a little bit of a more fit state over the course of the whole season. Conversely, you could argue that
they're overtrained, or
I don't want
to. Yeah.
I don't want to ruffle feathers, but does fatigue come into it? I know that some of the ACL research says you can't quantify fatigue, you can't prove fatigue. Fatigue has nothing to do with why people tear their ACLs, but I still know there's a school of thought that says that just can't be right. Like, when someone gets tired, they don't move as efficiently. So I don't know what the answer is. I know a lot of people argue about it, and I'll let them argue about it.
So if we were to look at a chart, just out of curiosity with this, in terms of incident rate of injuries, not necessarily game ending or anything like that, but just injuries in general, do we see kind of an inverse bell curve through preseason to playoff time, meaning that you're going to see a higher incident rate at the beginning of the season with preseason stuff, and then they get more conditioned and the play occurs, they're not doing as much gym work in between because the game schedule is what it is, and then they get to the end of the season, you've made it to the playoffs, and the body has been going hard. So do you see like higher incident rates at both ends of the bookends here?
Yes and no.
You love that yes and no stuff. I tell you right now. Could or could not. Okay.
So I personally, like anecdotally, I can speak to like our experience here. And when we've kind of taken a deeper dive into our inner squad injury statistics, you do see a spike in preseason. You see a little bit of a spike towards the end of the season, but what we have personally found to be kind of most effective of when we see more injuries is when we have a congested month, and not necessarily that month, but the month after. So it's not necessarily within the congested period, it's the period after the congested period that we'll see an increase in injuries.
Interesting. What do you attribute that to, you think?
The first place my mind goes is, and again, this is another controversial topic, but kind of that acute to chronic training load. And it's that after effect of the congested period where the body is just broken down, not recovering as well potentially, and that leads to an increase in injury incidents.
And what recovery tools do you guys have? Or I mean, maybe the owners aren't listening right now, but are there any tools out there that are on your Christmas list?
So we are incredibly fortunate. I think granted, I've only been to one, and I've seen a few others, but our new training facility is pretty top of the line. From a nutritional standpoint, they have everything they need. We have a sauna, cryo chamber, hyperbaric chambers, pneumatic compression. We have hot tub, cold tub, underwater treadmill. I'm probably leaving some other stuff out. Like we're very fortunate with a lot of the, again, we'll call them toys that we have to try to help our guys recover.
So I can imagine you're now in your mind, you're like, oh, well, if we front load some of that stuff as we get to the denser schedule time, maybe we'll see a reduction in injury incident rate. Yeah.
Hopefully, I think when you look at the recovery literature, sleep and nutrition are the big ones. Those are the ones that seem to have the biggest bang for your buck. The hardest thing for us is they don't sleep at the facility, and once they leave, a lot of our guys are not old, but older for a soccer player. We have a lot of guys who are over 30, and so they've got kids, young kids, and they go home and they're dealing with kids getting sick at night, dealing with kids that wake up early. So that's the one thing that we know is super important, but it's really hard to change.
Yeah, well, it sounds like you're doing a pretty darn good job though, Michael. and you got a lot on your plate. If you had some kind of parting advice to the young trainers, the young physical therapists that are finishing their residency or they're thinking about following a path, whether it's MLS or any sport organization, what would you encourage them to do?
Oh man. I will kind of give my spiel that I give a lot of, younger clinicians or students that I speak with. I'll speak from personal experience. For me, hard work makes up for a lot of things. And, you may not always be the smartest person in the room, but you can be the hardest working in the room. And I would say particularly in the sports environment, that goes a long way. If people see that you're well-intentioned, that you are willing to put in the work, it just right off the bat paints you in a positive light. I think that particularly in sports, networking is very important. And I will be the first to admit I am an introvert. I do not like being around a ton of people. I don't love going and starting conversations randomly. But to put yourself in situations to speak with like-minded people, to speak with people who might remember you somewhere down the road, just from that one little interaction you had, it goes a long, long way. A lot of times in sports, jobs aren't actually posted because word of mouth, someone says, hey, we're looking for this position. And someone says, oh, I know just a person. Yeah. They get introduced and then it's history. And then, one thing that I've tried to counsel a lot of people on as well is have a plan. Figure out what it is that you want to do. Try to talk to people who are in that role and learn the things that you can do along the way to try to facilitate that process for yourself. I think those are probably my big kind of three overarching ones. And maybe the last one I'll say is never stop learning. Because once you do, you're going to get left behind.
Right on. Great advice. I love it. Okay. So obviously we know how to follow the Nashville Football Club there. That's easy enough. And you guys look like you're climbing up in the standings right now. So that's a good direction. If they want to follow you, however, Michael Messer, where can we go? Like, do you have your own website, Instagram? How can we kind of check out what you're doing?
So here's where my introvertedness comes in. You can find me on LinkedIn.
Okay.
And you can find me on Twitter. At Twitter, I am football physio, FUTBOL. And no TikTok for me, no Instagram for me. Sorry, I just haven't caught on with those trends yet.
And you're not old enough for Facebook, so that's all right. Michael, this has been great. I really appreciate you taking some time out of your busy schedule, because I know you're packed, and it means a lot to me to just have an hour to chat with you. So thank you so much for coming on and being with me.
Yeah, Rocky, thank you for having me. The last thing I'll say, and again, it's just kind of targeted at your audience, is, particularly within MLS, over the past few years, you've started to see more physical therapists get involved and be part of the multidisciplinary team. And, for all those people who are out there who are maybe where I was a few years ago, I just want to tell them to keep working hard, because I think that, the opportunities will come. The World Cup is going to be here in 2026. The league is going to continue to grow. And again, I know I'm specifically speaking to the physical therapists here, but keep working hard, and I think you'll find your way into the sport.
Sweet advice. And I'm sure we'll see you somewhere in FIFA World Cup on the side of the pitch or something. And if that does happen, we'll have you back on and explain how it all went, describe your experience. But yeah, this has been great. I want to thank you so much for coming on.
Yeah, thanks for having me, Rocky.
And that brings this episode of the Zelos podcast to a close. I want to thank Michael for coming on, as well as the Nashville FC for allowing this to happen. And make sure you tune in every Monday, 9 a.m. Eastern, 6 a.m. Pacific, for another episode. So far, we're on a good roll and haven't stopped yet. Be sure to subscribe, tell a few friends, download an episode if you're going for a road trip. We'll see you next week.